thank you very much for these very, very lovely talks. I think we all learned a lot today, and now we will go ahead with the Q&A session that will probably further our knowledge on this very, very interesting area. So I have a few questions here, and maybe I will start ladies first, if that's okay with you. And how do you think? Let me ask this one for Professor Rosenmeyer, and it's about, can mothers' breastfeeding practice and food choices during pregnancy lead to a healthy microbiome for her offspring during childhood? What is your input in that, Professor Meyer?
Thank you very much for that very important question. As it's a Nutrition and Growth Congress, I think it's important for us to acknowledge, first of all, that good nutritional practice and nutritional intake has an impact on fetal growth. That's why we suggest that mothers who are pregnant eat well, because fetal growth also has an impact on immunity. In regards to the question around the microbiome itself, yes, there have been studies that have been performed. And I was very much involved in some of the systematic reviews around dietary diversity during pregnancy and, you know, the outcome in terms of the children. I think a study that I really enjoyed and really liked, and I think for me really reinforces the importance, was a study that was recently published from the New Hampshire British birth cohort. And that study indicated they followed the dietary intake from mothers during pregnancy and then immediately after birth, and found that the dietary intake had a direct impact on the microbiome. And you will have seen during my talk, I talked about the entero-mammary pathway that we are proposing, and it's suspected that it's through that. But then as soon as the baby is born, depending on the mode of birth, whether it's C-section or whether it's normal vaginal delivery, that gets modified. So yes, there is an impact. In regards to breastfeeding, there are plenty of studies that have indicated that maternal diet can also influence the breast milk composition and therefore the composition of the microbiome. So I think the message really is on all fronts, not only in terms of growth and nutrition, but also on the microbiome. Dietary intake during breastfeeding and during pregnancy can have an impact. Norbert, have I missed anything there?
Yeah, so maybe something that is quite researched now recently and a bit debated is whether the maternal nutrition can also influence the breast milk HMO composition. And there's only, let's say, one indicative study that shows some changes. It's not completely clear what the changes mean, so they're relatively small, but also, you know, some HMOs are more up and some are more down with specific dietary changes. But we looked at that in a larger cross-European study, and we did not see really a clear signal. Maybe it's because the diets were so diverse between the geographies that we have across Europe that we did not see a signal, but this is definitely a question to investigate. And I mention this because, you know, the HMOs are the principal elements probably that changed in the infant microbiome.
Exactly. And I think here also the message, I think the overall message in any case from both of our presentations is that good nutrition during pregnancy and breastfeeding makes a difference. Whether it has this direct impact on HMOs is not clear, but nutrition is like a domino. Your one factor influences the other, and we know that micronutrients impact the microbiome as well. So I think it's the holistic approach and thinking about that.
Yeah, definitely agree.
Excellent answers, and for us, for clinicians and all over the world, I guess not only, you know, Europe and Latin America in my case, but you know, there's a lot of issues concerning about how picky feeding should be during pregnancy, and I think this is a very, very, very broad view on what should we be recommending or prescribing during pregnancy. And here's another very interesting question for Professor Norbert Sprenger. What is the significance of the early bifidobacterium peak during development of the gut microbiota? And what boosts bifidobacteria in early life? Isn't this interesting?
Yeah, this is definitely interesting, and I think I would start, as I showed in the presentation, that there is really something very fascinating, that there is a kind of a progression, and this progression of the microbiome seems to go through a peak of bifidobacteria, and then as soon as you diversify your diet from a milk-based diet into the diverse complementary diet, you diversify your microbiome, the bifidobacteria go down, other groups come up and are more dominant. And obviously that changes the whole metabolic signature, let's say, of the ecology that we have in the gut. Now, what's so particular about that peak? I think the first element that we have to consider is when you disturb that peak, what happens? And I showed you the consequence if you have frequent antibiotic use on immune outcomes. I showed you the C-section that delays that peak, it seems, or it decreases the peak. And all that influences somehow the immune education, the immune competence development that we have in the infant. So that indicates something is really linked to that peak. And now, just recently this year and also end of last year, there are very interesting studies coming up that show now the metabolic profiles of this, let's say, specific bifidobacteria and how these metabolites, in fact, affect different immune pathways, being the boosting of, or the skewing of T cells, so into the Th1 rather than a Th2 profile, be it the anti-inflammatory properties through specific receptors that are also apparently important in utero, that are shown to be important in utero, like the AHR receptor. And that comes with certain metabolites that interact. Now, a particular dominant metabolite of bifidobacteria is acetate. So typically what you see is early on, you see that acetate going up, and then only butyrate, propionate, and so on, they come later during the introduction of complementary diet. And now what we could also see is that with this acetate peak, we can see an association to better protection from, prospectively, from respiratory infection. And this fits very well with different studies in preclinical mouse models, where there is protection from gastrointestinal infections shown through acetate specifically that comes from bifidobacteria, similar to respiratory infection protection through a pathway that involves interferon. And now just again this year, something came out where also the acetate influences the immunoglobulin A production. And that specifically, again, on certain commensal bacteria to modulate probably the dynamic of the microbiome. So I think there's plenty of elements now, and I think we need to really see all the different pathways. And it seems to be that many kind of converge into similar end benefits on immunity and immune education, but it comes through different angles with the different metabolites. So I think this is an extremely fascinating field that takes a lot of speed recently. And please, Rosanne, if you want to add anything, because you are involved also in this field. So any comments?
No, I don't. I think you've mentioned everything, but I think this link with IgA and also the skewing Th1, Th2 is really where we've also been looking from a breastfeeding, influencing the allergic march. And I think it's now just trying to put it together and come up with clear guidance. And I think that's lacking.
That's lacking, yes, indeed.
Yes, I think it's fascinating, and I think we believed earlier that lactobacilli were those very, very definitive components, and now bifidobacterium has drastically changed our view. So this is I still have so many questions and so few time, but let's talk about this other one. Let's see, should breastfeeding moms take probiotic supplements to improve child's microbiome in terms of immune system? I think this will also enlighten and summarize a little bit of what we've been talking now.
Yeah. So thank you for that question. I know we are under time pressure. So I think Norbert has already put the ground baseline down with his first answer with a lot of that. And I think the short answer is that at the moment, there are lots of studies that have actually investigated that. The problem with putting them together is that different strains have been used. Some started in pregnancy in the 3rd trimester. Some started just when the baby was born. And so therefore, at the moment, no guideline outside of the World Allergy Organization. The World Allergy Organization suggests, based on low evidence, to say that during pregnancy and breastfeeding, there's some low evidence in regards to allergy prevention. And that is at the moment the only population where we say routine supplementation. I think a quick note here is, as an individual, and in one of my last slides, I always say you think about a guideline, which generally is for a population, and then you think about the individual in front of you. And then I think I often have an individual in front of me where a child is really unwell, where I do suggest probiotics, not necessarily where I have exact evidence, but I think as clinicians, we also need to ask ourselves what harm can be done. And if I have a non-immunocompromised child, then sometimes what I do is I do recommend without having the clear evidence. Would that be fair, Norbert, to say, no guideline, but I don't think we can't say there's no evidence.
We cannot say there's no evidence. I think in terms of allergy, there is interesting data that looks very promising. And in terms of doing no harm, obviously, you're absolutely right. And I think we learn also more, as you said, there's different strains used and so on. And now we learn that we need to be careful on what we use and what exactly do we expect. And this is the same from the commensals. Maybe not all bifidobacteria do the same. We need to be careful and see which ones do what. Do we have them or do we not have them? And then we can also get the probiotic guidelines accordingly, that we adapt it to what is already there, what is not there, in terms of function.
Excellent. And I believe for pediatricians, also the area for the really tiny babies, there's a huge area for that research question, right? About probiotics in the tiny ones, the small for gestational age and premature. And I'm gonna close with this probably interesting question for you about it's about research, and regarding research on microbiome and infant nutrition. What do you both consider the most important recent current development in this field?
Rosen, you want to start or shall I start?
No, I think you should start. You're at the fountain of knowledge. I mean, I know from a clinical perspective, but I think you should start.
You gave me that hint already in your introduction, because I think personally, there's so much that we recently learned and that we see as association, what happens in utero, that there is a lot of metabolites from the future mother's intestinal microbiota that travels through the body of the mother and can influence the infant, and the in utero priming of certain pathways. And I think this is the field that we absolutely need to investigate more, and where we have good hope, that things should go right from the beginning. And the beginning is not the birth, it's before. And that's, I think, where I would start, and where I would think we need investment and understand this better. There's recent very nice papers also showing what is in the meconium, in the first stool, that this actually can be predictive for future immune health. There is also the other evidence about the metabolites that can influence, in fact, the T cell priming again. And this is independent of the seeding of the microbes from the mother to the infant. So it's an in utero effect per se, and not a seeding effect. And then the second field, I think, is that we lose maybe a little bit culture and tradition. So with breast milk, we have that model. So we know what's the right nutrition. But if you come to the next phase, when we lose that information from, let's say, past and so on, we may get it wrong, and we may introduce too much sugary drinks, too much sugar diet, low fiber diet, and so on. And this, I think, is a big risk for the microbiome and a big risk for immune health.
Wow, I truly believe this. This has been a very, very enlightening session. So we're very short on time now. Our time is up, but I believe this is the field that we will be hearing about in the next few months. And for us clinicians, pediatricians, and all the people in the scientific arena, this is very, very, very enlightening. And I wish to thank you both for your very, very nice talks. This day, and for our sponsors for having us today, and for all the audience all around the world. I'm pretty sure that this has been a very, very interesting topic, and we'll have to say goodbye for now, and keep enjoying our Congress.
Thank you very much.
Thank you.